In this presentation, you will get to know more about the management of anemia. Anemia is a common condition with significant impacts on overall health, so prevention strategies are critical to reducing its prevalence and consequences. Taking a daily multivitamin can help ensure individuals meet their essential micronutrient requirements. A balanced diet rich in iron and vitamin B12 is important, including foods like red meat, poultry, fish, eggs, dairy, and seafood. Iron plays a key role in hemoglobin production. Folic acid is another essential nutrient for anemia prevention, and leafy greens, citrus fruits, lentils, and fortified cereals are excellent sources of folic acid. Regular screenings, such as blood tests, help to prevent anemia by enabling early detection, especially for at-risk populations. The following section, the treatment of anemia, will be explained. There are different treatments for different cases of anemia. For example, in the case of acute blood loss, nutritional deficiencies, defects in bone marrow, chronic kidney diseases, and RBC's destruction, known as hemolytic. Acute blood loss anemia is a condition that requires immediate intervention. The treatment focuses on stabilizing the patient, restoring blood volume, and ensuring adequate oxygen delivery. Key strategies for managing acute blood loss anemia include administering intravenous fluids to maintain blood volume and prevent shock, which is a life-threatening complication. Cross-matched packed red blood cells are transfused to restore hemoglobin levels and the oxygen-carrying capacity of the blood. Cross-matching ensures that the blood products are compatible with the patient's blood type. Oxygen therapy improves oxygen delivery to tissues during acute blood loss by administering supplemental oxygen. Another key component of treatment is establishing at least 2 large-bore intravenous lines for the rapid and efficient administration of fluids, blood products, and medications. Blood transfusions replace blood that is lost through surgery or injury, or they provide blood if your body is not making it properly. After a doctor determines that the patient needs a blood transfusion, the patient will be tested to ensure the blood given is a good match. Blood transfusions usually take 1 to 4 hours to complete. The patient will be monitored during and after the procedure. Blood transfusions are usually very safe because donated blood is carefully tested, handled, and stored. However, there are some complications that may occur. There is a small chance that your body may have a reaction to the donor blood, which can range from mild to severe. Other complications may include fever, heart, or lung problems. Some people may suffer from iron overload, leading to excessive iron buildup. Additionally, there is a very small chance of contracting an infectious disease such as hepatitis B or C or HIV through a blood transfusion. For nutritional deficiencies, anemia, dietary supplements are recommended. Vitamin B12 supplements or shots can help treat vitamin B12 deficiency anemia. Iron supplements can increase the iron in the body, which may help treat iron deficiency anemia. Oral supplementation of iron is by far the most common method of iron repletion. The dose of iron administered depends on the patient's age, calculated iron deficit, the rate of correction required, the ability to tolerate side effects. Oral supplement of iron may be associated with side effects, which include metallic taste in the mouth and gastrointestinal side effects such as constipation and black tarry stools. Intravenous iron may be beneficial in patients who have intolerance to oral iron or require rapid repletion due to acute and ongoing blood loss. Defects in bone marrow anemia treatment include a bone or blood marrow transplant, also called a hematopoietic stem cell transplant, replaces faulty blood-forming stem cells with healthy cells. When the healthy stem cells come from the patient, the procedure is called an autologous transplant. When the stem cells come from a donor, it is an allogeneic transplant. For allogeneic transplants, finding a donor whose blood cells are the best match for the patient is important. Bone marrow transplants are usually performed in a hospital. Often, the patient needs preparation and must stay in the hospital for 1 to 2 weeks. On the day of the transplant procedure, the patient will be awake and may receive medicine to relax. After this, the doctor will monitor the recovery. Then the patient will be given detailed instructions on how to prevent infection and other complications. Although blood or bone marrow transplant is an effective treatment for some conditions, the procedure can cause complications. The required medicines and radiation can cause side effects, including vomiting, diarrhea, hair loss, and liver damage. Bone marrow transplants also can weaken the immune system against germs and increases the patient's risk of infection, making preventive measures and close monitoring essential during recovery. Some people may experience a serious complication called graft versus host disease if the donated stem cells attack the body. Graft rejection, known as stem cell rejection, happens if the body rejects the donor stem cells. This is more common in allogeneic transplants, especially when the donor is unrelated or less well-matched. Graft rejection may be treated with growth factors. Sometimes a second transplant can be done. In cases of chronic kidney disease anemia, the erythropoietin therapy is preferred. Erythropoiesis-stimulating agents, ESAs, are pharmacologically synthesized recombinant forms of EPO that are injected through the skin, signaling the bone marrow to produce more red blood cells. Anemia due to increased red blood cell destruction, also known as hemolytic anemia, can be managed based on its underlying cause. For hemolytic anemia caused by faulty mechanical heart valves, the treatment involves replacing the malfunctioning valve. If medications are the cause, the offending drug must be identified and discontinued. Splenectomy may be required to improve the patient's condition by reducing the overactive spleen's destruction of red blood cells. This is all about the management and treatment of anemia for now. Thank you.